following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
Welcome to Doctors on Call. Tonight's topic, girls' health. Two experts are here to answer your questions. Now here's your host, Dr. Maureen Hashmi.
Good evening. As young girls grow into teenagers, they face a whole new realm of health issues. From first periods to STDs, there's much adolescents and their parents need to know. Are irregular periods normal for teens? Should your daughter get an HPV vaccine? What's the best way to prevent an unwanted pregnancy? We'll get the answers to those questions and more tonight from our two guests, Dr. Pamela Murray, the Chief of Adolescent Medicine at West Virginia University, whose special interests include the treatment of adolescent menstrual problems, and Dr. Sean Rowan, an OBGYN at WVU, specializing in pediatric and adolescent gynecology. If you'd like to ask our guests a question, give us a call. Our lines are now open. Pam, let's start by talking about irregular periods. Is this a common thing for teenage girls?
Periods that are a little bit irregular are very common. Probably the biggest problem with periods when they first start is that girls start developing cramps and sometimes have moodiness or PMS before their periods. But periods should start getting pretty regular within a year or so, and anything that goes much too long or has really long periods without having a period should really come to a doctor's attention.
And be evaluated.
Yeah.
Sean, how about the first visit to a gynecologist? When should young girls, teenagers, be seeking out help for that?
We generally recommend that young girls see a provider around age 13 or 14 for an initial reproductive visit. This doesn't have to be a gynecologist. It can be any provider, whether it's a pediatrician or family physician, as long as they are comfortable with gynecologic issues and a gynecologic exam. This initial visit may not include a gynecologic exam. The goal of this visit is to allow the girls to become comfortable talking to a provider about issues such as menstrual issues, contraception, and to ask any concerns that they may have about puberty and other things.
Great. There's been some information recently about whether or not the gynecologic pelvic exam is actually obsolete. Do you think that there are cases that you would defer doing a gynecologic exam, a pelvic exam on a teen?
Yeah, there's definitely times that we can delay or completely avoid the exam. Recently, the new guidelines for an actual pap smear is to start around age 21. I think it's important to differentiate between a pap smear and a gynecologic exam. A pap smear is when we actually are taking a scraping of the cervix and sending cells to pathology to be reviewed for precancerous cells. But there are times that we need to do an exam that technology may not allow us not to do the exam. If a patient has a concern about a lesion or irregular bleeding, that may need an exam.
I think some of the delay in screening for PAPs is related to the fact that they think that the HPV virus is probably fairly ubiquitous and can actually resolve in some of these patients. So that's probably maybe where we should go next is, there's a lot of information about HPV now and the HPV vaccine, also called Gardasil. Are you recommending that to patients? Pam?
We've been recommending that for really since the vaccine came out, both because it has the ability to prevent cervical cancer and genital warts and really probably some other kind of cancers that develop at other kind of mucous membranes in the body. I think HPV is different than a lot of the other sexually transmitted infections or STDs in that I tend to describe HPV as being kind of the common cold of really any sexual contact. Because
nice way to put it.
you don't have to have intercourse. There's that virus on the outside as well as on the inside. So it can get easily transmitted, and really almost everybody who has any intimate contact will get exposed to the virus. And then most of the time, it goes away on its own.
Clears on its own. I think that's probably a good point with condom use also for teenagers who think that if I use a condom, I can't get HPV, when in reality, because there can be transmission from the outside, that they certainly could get it as well. How many different types are they now, HPV viruses?
There's at least 40 different types. We know that there are a few types that are more prone to cause cervical cancer, and there are a few types that are more prone to cause genital warts. There's a vaccine that will cover the two most common that cause cancer, as well as the two most common that cause genital warts.
So really there's actually 2 vaccines that are on the market now, one that covers the 4 viruses, the cancer and the warts, and the other one that just covers the cancer viruses. Is there, when you're having these discussions with adolescents and their families, is there a reason that you might want to do one over another?
Well, I think I've never met anyone who thought they would ever want warts if they thought they had an opportunity to prevent it.
Right.
I think people sometimes worry, does this immunization or even contraception make people more likely to have sex, and that not giving it would stop them? I think we have no evidence to believe that that's true. I think there are so many things that contribute to those decisions in any person, in any family, living in any community. And we do know that families where there's more discussion about sex and sexuality, in fact, people tend to make more thoughtful decisions and are more likely to not engage or to actually use good contraception and good prevention from STDs. So in a way, HPV vaccine is another opportunity to also encourage people to talk about it, which may prevent it in yet another way.
Right, rather than an endorsement really to have sex. How about the HPV vaccine for boys, which is a whole another interesting concept?
Right, and is now available, recommended by the organizations that really have been known to make thoughtful decisions about what vaccines are safe and useful and a good investment to make. So we are offering it to young boys who we see as well.
Great.
And I'm, I don't know if it's a surprise, but people are interested. And many, many families that have teenage boys we see are really electing to get the vaccine series.
So hopefully the next generation, this will be less of an issue because both boys and girls will be vaccinated against the virus. We actually have our first caller. It's Lisa from Logan County. Lisa, can you go ahead with your question?
Yes, ma'am. I am a breast cancer survivor, and I have a 20-year-old daughter, and I would like to know, when should we start having her examined for that, and is it too early for her to go ahead and start her gynecological visit?
Okay, so I think the question is, you've got breast cancer, you have a 20-year-old daughter, and you're interested in finding out when she should be examined to help prevent, obviously. Sean, do you want to answer that one?
Sure. I think it's important for a 20-year-old to be doing self-breast exams at home. The chances of finding a cancer at the age of 20 is fairly low, but at least she can understand what her breasts feel like, and if there's any changes, she can alert a physician and get further testing at that point. And at age 20, it would be time for her to start seeing a provider of some sort, whether it's a gynecologist or a family physician that's comfortable with gynecologic and breast exams.
And to also remember, I think that mammograms, we don't actually recommend that you get a mammogram until baseline, anywhere between 35 and 40. However, if you have a first-degree relative, like a mother or sister, it's 10 years younger than that woman's diagnosis, so that may actually be earlier than the recommended guidelines. And to remember that there's hereditary breast cancers also, screening for them. Okay, great. In terms of prevention of pregnancy, can we talk a little bit about what are the mechanisms and what's available on the market now for prevention in terms of contraception?
It's one of those areas where everything changes and nothing changes, or slowly. So Condoms, first of all, are important to be used all the time, and they really do decrease or prevent a number of STDs as well as pregnancy. When we talk to young people who usually don't want to be pregnant, they may have some mixed feelings, but certainly a part of it is that they're trying to prevent pregnancy, is we encourage dual methods so that they both use a condom and have some other kind of effective hormonal contraception. Birth control pills, which there are many new brands of, so the names change, but the basic mechanism stays the same. When taken properly, are very effective. The pills available in 2 other forms now. The patch, which I think we're not using as much of as we did when it first came out about a decade ago, and a vaginal ring, which for people who like it, they love it, and the other people seem to not really be interested at all. And then there are a number of other progesterone-only methods, which include what people refer to as a shot or Depo-Provera, and then some IUDs that I think Sean might want to speak to.
Yeah, there's 2 types of IUDs. There's a progesterone-containing IUD, and it's good for 5 years. And there's one that has no hormones, and it's made of copper, and it's good for 10 years. And these can be very good choices for young women. Traditionally, they've been placed in patients who have had children before, but they can be placed in patients who have not. And people who have contraindications to estrogen-containing contraceptions, these may be very good options for them.
In addition, with the Mirena, the hormone-containing, there's some other benefits they can have also.
Yes. Yeah, the progesterone in the Mirena is very effective at helping with heavy menstrual bleeding as well.
So a dual advantage.
We also see many teenagers and young adults who have other medical problems, who now are thriving and doing well as young adults, who decades ago might not have survived or may have been so overwhelmed with other problems that contraception wasn't really high on their list or their doctor's list. And for many of them, Mirena is a really good choice of a contraception that doesn't interact with either their other medical problems or medications they might be on.
I think the option for having contraception that is as effective as a tubal ligation for 5 years without having to take something daily is a real appeal, especially for young, busy mothers who think they might be not so good at remembering the pill. I think that's kind of where the ring comes into effect for a lot of women because, again, they don't have to remember anything. It's one time a month and that's it. How about the patch? Are you seeing a lot of girls that you're giving the patch to? Because again, it's easier for them not to have to take a pill?
It is easier. It did have some bad press there for a while, some increased risk of blood clots. So there are patients that it is a good option for, and that's something that should be discussed with your provider, if that's something that you think you may like.
Great. How about Implanon? Implanon came on the market not so long ago, but there's definitely a group of, especially teens, that it may be beneficial for. How about Implanon? How does that work?
These are progesterone-containing rods that are placed under the skin, and similar to the Depo shot, it gives the progesterone and is very effective at preventing pregnancy.
It lasts for 3 years,
yes.
Right? So that's really nice for especially teenagers who, want to make sure that they don't have a baby while in high school or even in early college, etc.
Right. And where getting somewhere to get another shot every 3 months sometimes can be just a hardship or challenging, and knowing that you have something there, whether or not you go back that often, really makes a difference for a lot of people.
So I think you're referring to Depo-Provera, which again, is a nice contraception option for young women because it's only several times a year. They don't have to remember something. It's very effective. What are some of the downsides that you see to Depo-Provera? I hear a lot of, my friend gained 20 pounds and I don't want that medication. So do you get that?
Yeah, so even taking a step back, people still worry about weight gain with the pill. And the birth control pills that are on the market today, as I would say, on average, don't cause weight gain. So if you put 100 young women on a pill, they're not going to, on average, gain more weight. So there's might be a few who lose a few pounds and a few who gain a few pounds. But then there are other options, and the differences between one brand and the next sometimes takes care of that. So in contrast to that, there is some evidence that women on Depo do tend to gain weight, but not everybody does. I think in part the mechanism is it makes people hungry.
Progesterone.
And I think people who already have trouble with their appetite and their weight seem to be the people who put on more of the weight when they're using Depo. And women who are thin to begin with sometimes come back saying, I thought this was going to help me gain some weight. It didn't work for me. But everybody's different, and you don't really know if it's going to happen to you until you give it a try. Right. On the other hand, with pregnancy, women gain weight, and it's also weight that doesn't come off so easily even after they're stopping, even after the pregnancy is over. So
take your pick.
Right. It's all, what are you avoiding when you kind of take
right.
a little bit of
I think the other thing with Depo-Provera is that there was a new recommendation several years ago about how long to give it, because prior to that, we could give it indefinitely, and now that recommendation has changed on how long to give it.
There were some concerns about bone loss, essentially, was the main concern, but over time, studies have shown that that's probably not as much of a concern as it initially was. And then if it's an effective birth control for that patient, that it's okay to leave them on it.
And that bone loss is reversible.
It is, yes.
And the one other part of the Depo discussion is also that usually after the first 3 shots, the majority of women stop having periods. And a few people say, oh, I still want to have a period, but certainly for the young women I take care of, that's always
added benefit.
A really big plus column, and that they may not have to worry about periods and have few, if none, is generally seen as a huge advantage.
And I think that's part of the counseling when they come in. If they can wait it out that long through that period of irregular menses and breakthrough bleeding and get to that 9 months, then they're generally very happy. It's the people that kind of stop before that point, maybe after 1 or 2 shots because they have a little irregular bleeding and are bothered by that don't get the full benefit.
Right. When we see, sometimes people come to us because they want to stop periods for a whole variety of reasons, and really the 2 options that we offer people are to either take Depo, and that'll give you a pretty good chance, or sometimes using, regular birth control pills and just taking them continuously rather than taking them in a way that most of them are packaged so you have a period every month.
Right, and so having periods every 3 or 4 months seems like a real advantage to especially a lot of adolescents. Are you having a lot of patients that you're able to use extended cycles on?
Yes, and it is safe. There's always.
Are there people that you wouldn't do it on, that you would not do the extended regimen?
There are some patients that actually do prefer to have a menstrual period, as Pam noted, and that may not be the best choice for them. But for most patients, it is a decent choice. Some of them will have spotting and breakthrough bleeding if they take it too long, and they may need to go back to the monthly pills.
How about immunizations? That's a really hot topic with teens and, of course, parents who have kids that are going into college. The whole meningitis every year, and we notice that there's deaths related to meningitis in a college-age population. How about immunizations? Do you get a lot of questions from parents about immunizations and what to give them? Yeah,
we get a lot of questions, and the world of immunizations in teenagers has changed so much in the last 10 years. I think 10 years ago, you'd want to make sure they had a tetanus shot, and Menactror, which is one of the meningitis vaccines, had become available. So some colleges were requiring it. And since then, we have the human papilloma virus that, while you can give it, most people give it at 11, there's still a lot of people who haven't gotten it. So there's this catch-up. Hepatitis A, which is a virus that causes a hepatitis that usually comes from food and water, but if you're ever going to travel in your life or potentially are exposed to food and water that's less than clean, so I'm now advising teenagers to get that. With their new tetanus, we're also giving them protection against pertussis or whooping cough. Since the little babies who get whooping cough usually get it from young adults who have it. And if you get whooping cough even as a young adult, it's not as dangerous, but it's one of those very prolonged
Unpleasant.
respiratory infections that you're wondering 2 months later why you're still coughing. I think influenza or the flu vaccine is something that now everybody's much more concerned about getting regularly, and at least this year we got both of those flu vaccines in one. And chickenpox or varicella, the recommendation is now that you get a second chickenpox vaccine if you only had one. So I hope I didn't forget one. But really, it's now become a big part of well visits for teenagers, figuring out which ones you got and which ones you still might need an extra dose of.
About menstrual medications, is there any medications that you recommend for those teens that come in and say, I have premenstrual symptoms or I'm having lots of pain with my period? Is there anything that you in particular like to recommend for that?
A lot of times, birth control pills can be very effective for this. Not just the birth control pill, but other forms of birth control. So it's if the patient's also looking for contraception, that can a lot of times help. Just over-the-counter Motrin seems to help a lot of times with these patients as well.
Or the twice a day Aleve, naproxen's nice because it's only twice a day and people can tend to remember that. Is there anything else that you like to use, Pam?
Well, I use a lot of the naproxen products because if you take it in the morning, it probably works a little more quickly than the ibuprofen, which is still my second favorite drug for this. And then it'll get you through a school day or a work day before you start feeling bad, so that moms aren't getting those phone calls at lunchtime. It's
time to pick
I felt
up your
good for a
kid.
while, but now it's really hurting me again. And while it's not so well known, if you take either of those medications, ibuprofen or naproxen, regularly, albeit for cramps, you actually have less menstrual bleeding. And so that's been known for a long time, not promoted so much, perhaps. So, and the combination of birth control pills and ibuprofen or naproxen really
is a great combination.
Is a kind of wonder combination. There are still a lot of over-the-counter medications that are sold for cramps and PMS and menstrual complete, whatever that's supposed to be. And those often have odd combinations that I think are left over from before ibuprofen and naproxen were around. So you often are getting acetaminophen in those kind of combo drugs, which really doesn't work all that well for cramps. And you need to really read those labels carefully. There's even one or two that have really big doses of aspirin, which we've really been discouraging people to not take really for decades.
So perhaps the patient actually bringing that medication into their visit and reviewing it with their provider would probably help. I think the other part, with painful periods is oftentimes what happens is the patient will take the medication after they've already had cramping, and if they can take that naproxen or Anaprox before they start actually bleeding, then it inhibits that process from starting, and the cat's not already out of the bag.
So it's the prevention medicine that if you take it, you actually happen to have the pain medicine already on board. So.
Right. How about abnormal pap smears? There's been new guidelines now for deferring the pap. Are you seeing a lot of questions from patients regarding waiting on pap smears?
There are some, and some people are concerned about the wait, but the recommendation right now is to wait until age 21. Now that is for a general healthy patient. Patients that have HIV or are immunocompromised on chronic steroids, they may need to be examined earlier, but the general recommendation is age 21 now.
So it's actually delayed. How about the morning after pill? That's something that is always good to remind teenagers that's available, also called emergency contraception. Do you get a lot of patients asking for it, or do you find that most teenagers haven't heard of it?
We do get people asking for it, usually when they need it. And while more people know about it than used to know about it, there still are less people who know about it than I would think. And there are quite a few people have done studies, making calls, and even sometimes checking in populations where the doctors who work there think they tell people about it all the time, and yet the majority of people really don't know too much about it. It's now marketed, I think, under a couple of different brands, and there are a few things we've learned about it. One is that the sooner you take it, the closer you take it to the time you need it, the better it works, but you can probably have up to 5 days, but probably day 1's better than day 3, which is better than day 5. Right. And that even though some of them still come packaged with 2, you can take both pills at once so that you don't have to wake up in the middle of the night.
Great. We've been talking about girls' health with Dr. Pamela Murray and Dr. Sean Rowan. Thank you both for being with us. If you'd like more information, talk to your family doctor or visit our website at wvuhealthcare.com. For Doctors on Call, I'm Dr. Maureen Hashmi. Good night and good health.
Join us again next week for another edition of Doctors on Call.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.